Hello, my name is Dr. Richard Martinez, and I'm a psychologist at Texas State University's Counseling Center. Thank you for joining me today as part of New Student Orientation. This presentation is particularly geared towards parents and family members in attendance. Although we don't have the privilege of meeting face-to-face this summer, I will virtually be presenting on the Counseling Center services, as well as the role of mental health in student success. I would like to highlight a few key points before we begin. First, we provide services to both the San Marcos and the Round Rock campuses. On the San Marcos campus, we are located in the LBJ Student Center on the 5th floor in room 5-4.1. We also have a comprehensive website that provides a thorough overview of our services. If you have any questions after viewing this presentation, please feel free to reach out to our office at the phone number listed on this slide, and we'd be happy to discuss those questions with you further. I would like to start our presentation by focusing on the first year experience. In the years leading up to college, a lot of attention is paid to the academic preparation, but little to the emotional preparation for that transition in the first year. If you think about it, as students adjust to college, they're handling greater academic demands as they're taking more classes, they have more homework, and their exams are oftentimes harder than they were in high school. They're also learning to juggle and manage their time as they're trying to balance studying and attending classes with a wealth of social opportunities on campus. They're also adjusting to new environments, so moving out from home and adjusting to living in a dorm with roommates. There's also social changes that are happening too, as students are leaving some of their friends from high school and starting to make new friends on campus. We'll be focusing today on some prevention tools that can be helpful with that transition period. As we talk about the psychological adjustments to adjusting to college, I want to go over the importance of our prevention tools. Let's think about those as the basic building blocks for good mental health. These are skills that we go over as therapists with all of our clients that are helpful for managing stress, managing anxiety, and managing adjustments. The first part talks about basic self-care. We think about sleep, for example. This is something I hear often with my students as they're transitioning to college, is that there's so much stuff to do within a day, whether it be social or whether it be academic, that oftentimes sleep gets put on the back burner. What we do know from the research is that most students need about 7 to 9 hours of sleep as part of staying mentally sharp, as part of being able to manage one's mood and emotions, and most importantly, to be able to concentrate. So being able to focus and recall information for an important exam, for those assignments and quizzes that we have coming up. So we can't underestimate the value of getting a good night's sleep. Next, I'd like to stress the importance of eating. For students who are used to eating those home-cooked meals, now the ball's in your court in terms of finding those dining halls and creating that routine and that schedule to be able to get those at least 3 meals throughout the day. I really encourage students to be creative. So let's say you have back-to-back classes throughout the day and you can't find that time to get to the dining hall. Pack some snacks. Go to the grocery store and get some of those little things that are going to tide you over between those meals. Because we know if you're not eating enough, that can also impact your mental health. So if you think about it, you might feel more irritable, you might feel a bit more short-tempered, we might have a harder time concentrating because we're focusing on our hunger cues, and that can be really distracting if we're trying to do well in our classes. I'd also like to stress the importance of staying healthy. We know from the research in this area that exercise is really important in terms of maintaining positive mental health. Really, the recommendations that I've read have stressed exercising 3 to 4 days a week for about 45 minutes in length. So that would be, when I say exercising, I mean vigorous enough to where your heart rate's raised a bit, you're maybe breathing a little bit heavier, things that are going to get your blood pulsating throughout your body. One of the things that I love about this campus is that we have a really great student recreation center. If you have a chance when you're on campus, I really encourage you to check out the campus recreation center and all the services that they have. There's really something for everyone. So let's say you're not one to lift weights. They have an indoor track, and they also have several pools that offer a different type of exercise for you, and even racquetball courts. There's also going to be a plethora of different opportunities for you to connect socially while you're here on campus. So there will be student organizations that are out in our quad area, which is the main area walkway throughout campus. There's going to be different folks that you're meeting in your classes. So parents, I really encourage you to talk with your students and try to figure out what are my students' interests and what organizations do they have on campus that could help that student find their sense of community. We know that having that social support is really important in terms of being able to manage difficult situations, because then we have folks to talk through those situations with, folks that have our back. And the last thing I want to stress on this slide is that we have so many resources on this campus that can help prevent us from getting to that level of stress where we can't keep up with what's going on and what's on our plate. So we have Slack, which offers tutoring services for students. We have the Student Health Center, which focuses on the physical health aspects of a student's well-being. We have Student Involvement, which hosts all of the student organizations on campus that I referenced. And finally, we have Student Success, which offers services for underrepresented students. So trying to get them connected to mentoring programs, services for first-year students living off campus, things like that. So these are all great offices I'd encourage you to look into further. As we've discussed, there can be psychological impacts of the stress of transitioning to college. However, there can be certain signs and symptoms that what a student is experiencing in that first year may be more than stress and might be indicative of a mental health concern. This information on this slide is very important because most freshmen fall within that 18 to 24-year-old range, which is when we know in the mental health field is the time when individuals experience their first episodes of things like depression, anxiety, and bipolar disorder. So for the students in the audience, I want you to be self-aware as you're starting college and to notice if any of these symptoms or signs are happening for you. So things like excessive worrying, crying more than usual, having difficulty getting out of bed, withdrawing from friends, from family, if that's out of character for you, big changes in your energy level, not caring about things around you, and turning to things like substances to cope with different stress or your moods. For the parents who are listening, you know your students better than anybody else does because you've spent so much time with them. I want you to pay attention to those same symptoms that I mentioned for the students and to reach out to us if you notice any of those things happening that seem out of character for your students. And we as the Counseling Center can hear your concerns and make different recommendations on how to support your student moving forward. What I want to emphasize with this slide is just to be aware of any potential changes that seem like they're out of character, that are coming, out of left field and maybe not in proportion to the different stressors that are on one's plate, because those types of things can cue us into something else happening. Now I'd like to discuss some strategies that you as a parent or family member can use to support your college student. First, I'd like to encourage you to listen. Be understanding and supportive of your college student and the different intensity of demands that might be on them, and listen to their concerns. Balance their need to make decisions for themselves with their need for input from you. Don't be afraid to ask them what's going well and what they might be struggling with. Try to reinforce both positive and constructive behaviors and solutions they've come up with to manage their concerns. Also, don't be afraid to share some of your own college or life struggles. This can be inspiring for a student to hear. But also remember that this is their college experience and it might look different from yours. Encourage your student to seek help from on-campus resources as needed. So for example, if they're taking a medication ongoingly for a mental health concern, encourage them to continue taking that and reaching out to the student health center before their prescription expires. Also, I'd like for you to act. So if you identify a problem with your student, don't wait for it to become a crisis. Do such activities as consulting with the counseling center. We're here for parents and families to discuss any concerning changes they might notice in their student and different strategies we can come up with to help them get back on track. Also, don't forget to follow up. So if a student comes to you and they have been struggling with a problem, I want you to check in with them a month or a week or a couple days later and just check in and say, hey, I knew you were struggling with this area. How's that going? Just so they know you're still thinking about that concern and that it's okay to continue to come talk to you about it. If there's one thing I want you to remember is that it's important for students to find their own way through college, but with supports. We want to walk that line of being there and letting them make their mistakes they need to make in order to learn, but also being available in case they need our help and support and our guidance. Now we'll have a chance to talk about our specific services at the Counseling Center. We'll start with what we do. Primarily, we do several different modalities of therapy. The first is individual counseling. So this is face-to-face with a counselor. Our individual therapy is short-term in nature, meaning that students have an upper limit of 15 sessions, and those sessions take place once every 2 to 3 weeks, just depending on demand for services. In addition, we offer group counseling. So each semester we end up running about 16 different therapy groups, which are small groups of students who come together with 1 to 2 professional staff members, and they talk about different areas of mental health. So there's groups specifically for anxiety, there's groups specifically for our Latinx population, there's groups related to social anxiety, groups related to grief and loss. Really, there's a group that could be helpful for quite a few students. The great thing about our groups is that those meet weekly and those don't count towards any session limits. So that's an unlimited service that we provide to students. We also offer crisis response. So for students who are experiencing a crisis or an emergency situation, our office is available throughout the business day to be able to respond appropriately. Furthermore, we have consultation and referral services. So for students who have been seeing someone weekly in the community back at home and they want to continue that when they're at college, we do have a case manager in our office who can help discuss those different insurance benefits, has really great lists of providers in the community within walking distance and within the bus route of campus who can help make those connections for a student if it's in their best interest to be able to continue those weekly services outside of our office. We also do psychiatric service referrals for students who could benefit from seeing a psychiatrist on campus. We have that partnership with the Student Health Center where we will refer students over for that service when that's appropriate. All of our services that we do provide are provided by professional staff members and by those who are in training under the supervision and guidance of a professional staff member. There's a few things that we don't do within our office. Those are long-term therapy. So we have those upper session limits that I mentioned of 15 sessions. If students are coming up on those individual session limits, we will talk about referring to a group or referring to off-campus for that continuation of services. We also don't treat severe mental illnesses just because of the spacing of our appointments and what we're structured to provide in terms of support. So for students who are struggling with severe mental illnesses, we will turn to our community partners to help provide the best appropriate care for them in those instances. And then finally, this could be different from the high school setting, but our counseling center does not provide any type of academic advising or coaching. Here are the steps for connecting with services at the counseling center and some important considerations. Students begin accessing our services by calling our office and requesting an initial consultation. During an initial consultation, students will fill out some paperwork and they'll meet with a clinician briefly to go over that paperwork and to gather some background information. And that information will be used to determine the most appropriate level of care for their individual situation. Please remember that there is no additional charges for services from the counseling center. And all of our services are confidential, which is mandated by our ethics code as professionals and also by state law. I want to just remind families that without a release of information about your student and whether they've utilized our office cannot be released. There's much more information about accessing services and confidentiality, as well as the breadth of our services on our website, and the link is contained on this slide as well. Oftentimes, I'll work with students who have already been in therapy within high school or middle school. If a student is transitioning to college and they already have a current provider, I really encourage you as a family to reach out to that provider and seek their recommendations. So find out from that provider whether the student is comfortable going into a 2 to 3 week model, or if that provider recommends that the student continue weekly services. That can be really important for the stability and to maintain those gains that your student has made as part of their mental health treatment. I want you to also consider the continuity of their medications. So if a student is seeing a psychiatrist or a general practitioner, make sure that they have enough medications to cover that transition period, and look into the different transition options on campus or off campus before August comes. That way the student doesn't end up in the situation where they're out of refills, out of medication, and their treatment becomes disruptive. As I mentioned before, the Student Health Center has many resources for psychiatric medications, both at the general practitioner level and through their psychiatry staff. I've mentioned this before, but it's worth saying again that the Counseling Center has a referral specialist who is really there to help individuals locate community providers for individual counseling, but they can also help with the psychiatric services and connecting with those as well. If you haven't already done so, please visit our website to get the most up-to-date information about the groups that we're offering and the different workshops that could be helpful for you as a family to support your student. At the beginning of the presentation, I mentioned the Counseling Center's website. I'd now like to go over a few things that you'll find on that website in detail. Our website is counseling.txstate.edu. If you go to that page, you'll notice that we have a family page that's available both in English and Spanish with different resources for parents and families. We also have a new COVID-19 resources page, which talks about different mental health resources related to the current pandemic. We also have videos, podcasts, audio tracks, and recorded presentations related to mental health. Additionally, we have suicide prevention information, and we have apps for mental health and relaxation. The Counseling Center is also very active on social media. We are on all major platforms: Facebook, Twitter, and Instagram. It's a good idea for parents and families to follow our social media pages so they get a sense of any service changes that we're making, any new groups that we're offering, and different events that we might be hosting. I also want to highlight the Minds Matter website. This is a new website that's designed to help parents and family members find answers to frequently asked questions about mental health supports available at Texas State, in the community, and online. It helps you identify and provide information to your Texas State student about where they can seek help for a wide range of concerns that can cause distress, such as finances, academic struggles, or feeling disconnected, as well as resources to support well-being such as counseling, medical services, and recreation. Please take a moment to look at this website when you can. I would like to let you and parents and family members know that we'll also be presenting to college students during Bobcat Preview. Bobcat Preview are the mandatory sessions that are available for students prior to classes beginning. We'll be talking with students about strategies for maintaining their positive mental health, as well as talking about suicide prevention and how to care and watch out for their fellow Bobcats. While I pointed out some of the difficulties with adjusting to college, it's important to remember that while transitions can be challenging, most of us not only make it through them, we grow and we learn from them. Students and families, you will too. Thank you for listening to today's presentation on transitioning to college and maintaining one's good mental health, as well as the overview of the services we have to offer at the Counseling Center. I know I've covered a lot of material in today's presentation, but I want to remind you and encourage you to please reach out to our office if you have any questions or want any further information about anything that was discussed today. We would be more than happy to discuss the different treatment options that we have available and any of the resources that may be of interest to you or your students. I hope you all have a great day, and I hope to welcome you to Texas State in the fall.